3 quick stretches, 1 easy exercise for instant relief. All the back Band-Aids kept us in the re-injury loop.
Everything changed when we gave up on instant relief and started on slow building. First with steady back investments with a gentle iso hold, starting with a high pad for less weight, and weeks later on a lower pad for more weight.
Once 2 minutes is easy with no new symptoms, restart on single leg with a high pad until 1 minute is easy.
Then beginning to microdose in assisted hinge reps, and after weeks of this, starting to go for full reps unassisted where you let the spine decompress and then recompress with strength.
Once 30 reps, slow and controlled, are easy, then you can switch to single leg where 20 reps becomes easy on each side.
Then you can begin loading if you want even more protection. This progression alone can and should take a year. Fast and easy is a sales pitch. There are no short-term solutions to long-term problems. Play the long game and make the deposits. For the full roadmap and more help coaching, check out lowbackability.com. Sign up at your own price. Okay, so we clickbaited you. The one exercise to fix your low back instantly, but we didn't lie, because when we say the one exercise, this is actually like 5 exercises in one. So you're gonna actually train the spine a lot more than you think. And when we say instantly, we mean you can start training it instantly right now for the next 2 years. So it's an instant 2-year plan. So we're kind of trying to take down the problem of the sales pitch of fast and easy.
Yeah, there is no instant fix right away, but you can instantly start working on your back.
First, before we talk about the back extension, which is the one exercise, which is 5 in 1, what's the #1 question we get?
I don't have a machine. What should I do? Is there an alternative that I can find to the back extension?
Bring it in. Bring it more. Listen here, funny people. We care about you. I'm gonna say this because I care about you. Sell a kidney. I really don't care. Actually, I'd rather you take out a disc, get a surgery, remove it, and then sell it on the black market of backs. Sell whatever you gotta sell and get a back extension. So,
and to bring it back to reality in a way, like, how much is a back surgery these days? Somewhere between 30K and 50K. I don't know. You can find some for $100 on Amazon. Yeah. I think Valor has a really good one. We make no money. There's no benefit if you buy a back extension machine, but this is going to be the quickest route. I think quality-wise, this is going to be the best way.
Just don't waste your time on other stuff. You know? I mean, don't buy this one because you might kill yourself.
This is
not that great, but
it gets the job done.
Yeah, the back extension. If you're trying to makeshift one or try to use the GHD or the 90-degree one, it's just not as smooth and scalable. So, in all actuality, you could buy one for $200. You could change your gym. It is worth changing it. And if this is a priority to you, and you're gonna watch this 20-minute video on the step-by-step, don't take all this info and then go on a rinky-dink little makeshift. And
it makes a huge difference. It really does.
It's just needed. If there was a better way, I would love to be the modified to body weight at home. It's just, I don't have it for you. So, all right, let's go through the step 1. We didn't really plan this video because we know the progression pretty well. And we just want to make sure we hit all the nuances. So step 1, the concept of deposits. The quick fix model doesn't work. There are no short-term solutions to long-term problems. That's been my mantra. Because your problem didn't just start today, it's been years in the making. Well, the solution's gonna at least take months, if not years. So the very first gentle approach, when people say, hey, but what if even back extension holds hurt me and I can't do that? Usually what they mean is they tried to do the standard we put, the 2 minutes at a normal height. But if you could lean forward, not even feet on the pad, had it at your stomach, the strength you're using to not be flopped over is still working through the low back. So from here, if you did 30 seconds, you could even take weight off. This spectrum is just so scalable that it's a deposit. If you are broke financially, someone says, start investing, you have pennies. Well, start with the pennies and trust the compound. You get more money, you can invest more. You get more back reserve, you have more back money to spend, you can invest more. When I say back money, I mean, if you train your back too hard, you can't sit for the next day, you can't walk around, you screwed yourself. That's not productive. So underwhelm the tissue, but be consistent. So the back extension iso hold, step 1. Building up, this is like extreme easy assisted high pad. Then you go more realistic, actually on the machine, unassisted high pad, almost to my stomach. And then the eventual goal is getting to like a normal height where you would do reps. You have room to go forward, but you don't. And you build from here to a workable standard or a suggested goal of 2 minutes.
And if you've started with repetitions and you've never tried the isometric, I really recommend hopping into these isos. You may be really surprised how difficult this can be. And it's also just an endurance challenge. So
Yeah. And it's how much time under tension do you get to contracting things? If you have atrophy and inhibition, meaning shutdown of the low back muscles, you can hide stuff through speed. So I could do reps, and I have videos of me, put it on screen, even with weight, doing these like weird hinge reps, and it's just glutes, and my low back is kind of firing, catching me, but not. And that is a different quality of contraction versus nonstop, continuous contraction, steady input, no movement. The burn is very steady. You can't hide from it at a certain point. So the time under tension is better. And then also it's extension tolerance. When you're doing reps, we'll get to that, you're getting all this good stuff of moving the spine, but you could still have pain when you go like this and just lean back or sit in a chair. So the back extension iso holds are not a step. They're not level 1 like we're saying, it's more of a variation. But it's safer to start here, because if you mess up from doing too much of this, you get a little sore. If you mess up rounding and going hard, you could get a re-injury. So that's level 1, is a 2-minute hold, mastering it to where it's easy. The time frame for that. You coach a lot of our members through the app. What are some normal time frames? Just truthfully as a coach.
sure, yeah.
From short to long.
I've seen people go as quick as 2 weeks and as long as 4 to 6 months. So it's really going to be individual to where you're at. And that's where, if you're coming from a place of injury, like, take your time and really monitor how you feel in the following days. If you get through 2 minutes and then you're like not able to move or get out of bed the next morning, that's not a sign to move on to the next step. So really take your time with these, and the day after, I think, is more important than how you feel the day of.
And so the same way we started level 1, high pad to low pad. Now level 2 is the single leg. You want to show it?
Sure.
When we go back to single leg, we restart it. So I would even put it higher again. I would go back to high pad. So we made it easier, less weight is being held when you go high pad, but we're making it more difficult with the stability component. I just had a call with members today. Someone said, I do 2 legs, feels pretty easy and doable. When I do 1 leg, it's not harder, but the next day I feel spine instability or like weird symptoms. And that's showing what's special about the single leg. It's not just your hamstrings are gonna be burning, you're using 1 leg, but you use both sides of the big muscles for sure. But now what keeps you from this semi-tilt position? Because his whole body's straight, but he's a little bit off-centered. You could just show it from behind. So his body's straight, but his leg isn't in the dead center of his body. His leg is a little bit, you could switch if you're dying now. His leg's a little bit off to the side. So what keeps everything still aligned properly so he's not tilted like he kind of really wants to be like that? It's small muscles here along the spine, rotatorus, in the name rotation, multifidus, that go laterally, they go diagonally at every vertebrae, and that's stability. So stability, I consider it as strength in all directions at all times. To keep something stable, it has to fight right, left, forward, back. There's a bunch of little muscles doing that. And so that's why single leg holds can expose you to a new tolerance you don't have, get weird symptoms. So you hop up, I know I just bullied you.
All good.
Emotionally, physically.
Stop it.
Sorry.
You know what's interesting? When you go to an orthopedic doctor, they won't tell you about your multifidus, and they won't tell you about your burn, you know?
To just show this model. Show the model that if you go on the doctors on the shelf, they show everything that can break down that they operate on. So the bone, the disc, the nerve. You broke this, you got this bulging, herniating, and it's pressing on this nerve.
But you have live adaptive tissue in your spine, and that's something I just didn't know. That played into my fear. I was like, oh my God, the disc is out, it's over.
Yeah, it's all alive too. People think bone isn't alive. There's blood flow to bone, it's just so much less.
Yeah.
But the red tissue on the models, the real model, are those muscles. So this goes into what people think that their issue is their injury, that their diagnosis is the problem, and they don't realize stuff like DDD, a lot of cases.
Which apparently have.
Okay, well, that's good to know.
Yeah.
You signed the waiver before we started this whole thing?
Oh, waiver.
Okay, yeah. We don't,
No,
have,
but
we don't
like-
have an employee contract. We got to get more legit. But like when you start to hear you have bone disease and disorder, if it's not like immune related or something attacking from that sort of side, it's all the muscles that should be supporting aren't. So now there's extra damage that goes to bone. It's just like arthritic knees. You lose the big quads and the controlling muscles there. You lose the structural balance. Ligaments get worn more, and now it's just bones taking the force.
And imagine if you took the approach of, okay, let's not use our back now. Like, if you did just hurt your back, okay, you got to protect it at all costs. Well, you're never going to send an adaptive like stimulus to your back.
Speeds it up.
Yeah.
You just put it in a little back cast, just like an arm in a sling. So Nate just did the holds, and we explained why it's such a vital step. It's not just more on the hamstring. Now, after you do the high pad, we'll go back. The concept is trying anything new, find a way to make it stupid easy. So if you mess up and cross the line, the punishment is much less than if you just sent it and went for a really high level. So we're making it really easy, high pad. Then later, we're talking span of weeks, maybe months, you start to lower the pad.
Yeah. The single leg took me far longer to progress than the double leg, personally, on my journey. It was maybe like weeks for the double leg to progress, and then single leg just took much longer.
So going to single leg now, I'm holding a lot more of my weight. It's also using a bit more of the low back of the sacrum. Wherever this pad is really the peak force. So if the pad were at my chest, well, this is a trap 3 raise, and I'm trying to isolate my mid back. If the pad were at my knees, oh my God. If the pad were at my knees, now it's a Nordic, you know? So understanding wherever the pad lies, the opposite is getting sort of the peak relative force. Then you can manipulate. If you're like, okay, I feel a little weird back pain right at the base of my spine, the sacrum. Maybe put it a little higher and get more mid to low back. There's extra tools to work with this. So you don't reach any point and you're like, this one doesn't work for me, I have pain. So the level standard thing that we're going for, the suggested goal, is 1 minute on each leg. Take a little break between. Should be able to hold here. And when we say reach a minute, we mean a minute, relatively easy. You could do that 3 days a week and get no new symptoms. If we have members like this, they come into the program a 4 out of 10 pain the whole day, breathing, sleeping, walking. We can't tell them you should have no pain and you should only move on when you have no pain, because their 0 level is actually a 4. So it's like pain is a tool in its relativity, not its absoluteness. If nothing went up or down, that's good signs. Keep improving the measurables. So that's level 2. Level 3. Okay, so the problem I made, maybe that's a high pad.
No, this worked.
The problem I made on Instagram was trying to teach stuff very basic, that's short time cap, whatever. You do holds and you go for reps, like all the way down. So go do some reps. The problem is there's like 3 steps in between these. So what would be mini steps between iso hold and reps?
I'm a huge fan of the assistance once you start to go and move. And then you could even do like a half rep or a hinge rep. So a lot of people are like gonna feel pain if they hop right into flexion. So you can actually keep your back straight and actually just move it as a column. So now you're just gaining some confidence moving your spine.
And it's almost like an iso hold in the sense that everything's put together. It's trying to hold you in extension strength, but now you're bending at the hips and starting to relearn using hips and back. That's where I stopped though. That's where I just started getting strong at that. And I would grab weight and just do these little like fit chick, upper back rounded, just hip thrust in the pad.
I'm a huge fan of working towards that flexion though. So if flexion is what's gonna cause you the most pain, then long-term wise, the thing that's gonna like hurt you the most it's gonna be your most potent healer. So there are a lot of steps like in between here. So I love the assistance, and then once you feel comfortable, you can actually do like very light flexion. You don't have to go all the way down, and then just see how your body reacts to a little bit of flexion. Over time, again, I can't repeat this enough, but getting to the point where you can fully flex your spine and then extend on the way up
Yeah, so we do this cat-cow thing. So if you go chin down from the top, piece by piece by piece by piece, and then also the opposite, chin up, and then piece by piece by piece by piece, extending like a worm. You don't have to do it that way. You could do unwinding like a J curl now, and then come out of it that way. Some of it's nerve tolerance, doing the little worm thing with the chin, but leaving nothing to guessing and, you know, leeway. If you're gonna go thorough on this, make sure you feel comfortable at every spot. Now, one thing too, the practicalities. How long should people take on levels? The wrong question. That's why we can't say one quick fix, instant this, instant that. All that's lies. All of it's lies. There's no way for us to say how long it'll take because I don't know how long you've been injured. I don't know how messed up your tissue is. I don't know if you're in tune with your tissue, if you just are the type to work through things or you're very cautious. All of it's a lie. So our honest answer is you're gonna have to be your own back coach. And the practical advice I'd give, going from one level to the next isn't a light switch, it's dials. So if you're gonna go from holds now to reps, what that session might look like on Monday is you do one set. You've gotten pretty good at the iso holds. You do your 1 minute break, you do your 1 minute break. That would be your daily session. Well, now you do a little micro dose of the reps, and then you start to work, I don't know, 10 assisted reps. You do that for like 2 or 3 weeks, literally slowly upping the weekly volume where you can really see how you adapt.
And it's a gradual transition from one step to the next rather than just hopping right into it.
And it's not graduation because you still need all the qualities. So you might get to what we're gonna show now with the 4th level, single leg reps, getting the stability component we showed, but with the actual position of flexion and decompression. Now, even when you're at this point and you're working for the 20 rep suggested goal, you can do a good set of 10 each. Maybe that's where you're at, where it doesn't feel like pain. And then you add in at the end a little burnout, 30-second, 1 minute iso hold. So working your way through these levels isn't steps on a staircase. It's just, we're trying to lay it out as levels so you don't outdo your tolerance and mess up big time and hate us and hate training your back. So
yeah, and collect like how you feel after as data. So it's like, let's say you do too many reps. Let's say you got to 18 single leg reps and then you wake up, you're having whatever symptoms you've been having, and take that as data. Okay, let's try 10.
Yep.
You know, undershoot it and then see how you feel after that.
Yep, because our limiting factor is not going to be muscular strength. Because the thing is, the tissue you might flare up that causes a 9 out of 10 pain tomorrow doesn't have to be your big muscles. It could be something this big, one little ligament, it could be a force on the disc, anything. It could be bones pinching. This big causing swelling right there that leads to referral pain and nerve issues everywhere. So you can't listen to the big muscle pump, oh, I can do 5 more. As soon as something feels even untrustworthy, like it just emotionally, you're like, we should just wait and see tomorrow. And gain new evidence, but slower than you think. So
this is a lot about body awareness, and this allows you to really feel, okay, once I go to a certain point, then I start to feel pain. If you can learn, okay, I'm at the point where if I go a little further, I'm about to feel pain, that's a really good spot to be. Now you know, okay, I'm not gonna push it there. It doesn't mean we avoid that overall forever. That's where the assistance comes into play, and just playing the long game really helps.
So let's go back to the, I agree completely. I think we're speaking a little in circles just because there's so much misawareness. What's the word? Confusion, misinformation, and all or nothing thinking with this stuff. These qualities operate on a spectrum. So this last step, single leg reps, trying to get 20 on each, you're still using both sides of the back muscles. But you can find that maybe on the right, you can do 20, and then on the left, it just feels significantly harder and you get 15. And that might just be the battle of the small muscles. Or you didn't take a good enough break between the two.
Definitely take a rest, like a significant rest in between each side, because you're working both sides of your back.
So let's get you on to level 5. What we consider the last step is loaded. And there's a few ways to load it. Is this needed for everybody? Probably not. But if you're gonna go back to squatting, deadlifting, traditional lifting, you should see measurable failure on back extensions before you do a compound lift. So same thing, you can get some flexion. It's a little tougher holding the dumbbells to do the controlled segment by segment aspect of the spine. But he's doing really good control. Look at the tempo, like he's not rushing.
This is what I call owning the whole range of motion. If you're going down and then here you're like, oh, I gotta get out real quick.
Yep.
I don't know if you own that yet.
Yep. So the whole time frame from the very high two-legged iso hold to this point where he's pushing weight, push it till you don't feel like you can go any further if you're feeling safe.
Honestly, at this weight, I would rather use a barbell because I feel like my shoulders are fatiguing before
upper
the back.
We skip some upper body. So from level 1 to where he's at here, this is like a year.
At least.
At least. If you're actually coming from a place of injury and you're not just curious, you're not just back curious, like you're really in this, you're gonna have such a slow, steady journey that you might as well stop putting a timeline to it.
Yeah.
Because that's only gonna make it longer. You're gonna rush it, you're gonna get injured. I'll show the barbell too. For me, the standard I like with the bar, this is like a quarter of my body weight. I like higher reps. This is also low. Look, this is what happens if you fail. If you're like, I can't get up any higher, you literally can just drop it. It's not as suicidal as it looks. That's a super freak out fear that people have.
Yeah.
What if you fail? It's safer than failing on a back squat, in my opinion. So, 20 reps. This is now going more into what we're talking about last video. If you're trying to lift and never think about your back, I would like more endurance and strength with control.
And if you're an athlete, definitely this should be a goal for you, a long-term goal to work up to where you can move extra weight.
Oh yeah, this feels super athletic. This end range extension, if you took sprinters, people really, really fast that don't really lift too intensely, this is something they will naturally be good at.
Yeah.
Hip flexor raise, and that's end range extension. Low back, glutes, insane right now.
Wow.
I think I got 3 more.
Nice.
I'm burning like a motherfucker. I'm reaching head to ground. Yeah, that's a fun time.
Beautiful.
Okay, so what starts as rehab later becomes performance. And that's the one exercise that will fix your low back. But clearly it wasn't just one exercise. We did extension strength at neutral. We did extension strength with a hinge, flat back. We did extension strength in and out of flexion. We did with a lateral rotating component, single leg. It's even one exercise taken serious. Imagine that journey versus bird dogs.
Oh yeah.
No shade to it. Maybe back up a little bit, Jay. If you're gonna do, go right there. If you're gonna do bird dogs, this is cool, but where do I go next?
Yeah.
I guess I can, I don't remember. I don't remember.
What you're up to.
I don't, you see a lot of stuff. I was a trainer trying to get into Equinox gyms. I didn't put enough foam rollers on people's backs, so I didn't look like a certified tier 3 trainer. Okay, maybe you get on my back next?
I'm all good, man.
I don't know. Okay. We can do that after the video. But like, what's the journey? Because we're not just trying to get you feeling better for next week. We want you to actually get back to golf and have it not be stupid.
Yeah.
Which means real tissue changes over time. You need step by step by step. Just
I think this is very transferable to real life movements that you're going to do. If you're bending over to pick something up, well, now you have actually tested the pure low back strength.
Oh, that's true. It's true. I mean, that's the obvious. If we didn't cover this yet, train your low back. The low back is something to build, not to protect. If you were told to move like a robot or be careful, you should go get a refund.
Yeah, and you've also been told to lower your quality of life.
Yeah.
Which is just not an acceptable answer to me.
Yeah.
Like that was the biggest thing I was scared about. Like, how am I gonna get back to doing the things I love?
Yeah.
Like basketball is my favorite sport.
Yeah.
And like if you have sciatica running down your leg, you can't do anything.
Both of us have an interesting story. I'll make it really quick. our journey as patients, he was a patient in a chiropractic office. I was a patient at a physical therapy office. We were both around 20, 21. And after being a patient there, I kind of finessed getting a job. I talked up the owner a bit. I was really excited. My knee still wasn't fixed after surgery. And I got a job as a tech. And I worked at a physical therapy clinic for a year and saw the real inside of how do we treat and approach these chronic pain problems. He also did the same. Finessed, cute talked up the owner and got a job. And we both saw from the inside too, the way we treat it. And it's not as thorough as it may seem in a lot of these clinics. I'm not throwing his place under the bus, but for me, man, it's just like I would see people get a joint replacement at 40. And I just can tell from the 6 months of taking them through that knee replacement and seeing like their face and energy and lifestyle. They were gonna play soccer, they can't. I'm like, he's gonna die a decade earlier. His whole pace of chronic illness that would happen at 80 is gonna happen at 65. You just see the rate. And if there's one area you want to be young in, it's probably your spine. If you feel old there and you're getting fused and you're turning Mr. Bionic in the back, praying for you. And if you already have, it's not too late. It's not a matter of just, did you get this operation? Did you get a steroid injection? Did you get the surgery? It's your trajectory. Did you end up changing anything about the path you're on? The breakdown is not something to be accepted without a fight. You're accepting death from your spine, then to your lifestyle, then to your energy, to your enjoyment. And that is literally what keeps you alive and vital. So.
And this is, we say play the long game, and it's like, that is so vital to this. I think that's something orthopedic offices and just like the medical industry is selling as a quick fix. If your back's been hurt for 20 years, does it sound right that your back would be fixed in a day? Because to me, that doesn't add up. If you've experienced a long period of pain, it doesn't make sense for you to heal right away.
And think about the YouTubers. I don't want to make this just an endless rant, but like we poked fun at the one exercise to fix it instantly, and I want violence with the industry. That's me as the former lost kid that was injured. As the trainer who's a little bit perceptive and see what's going around, it's not so evil. People are asking the wrong questions to the doctors, to these content creators. So the providers are giving the wrong supply. The demand is, give me the fast, give me the quick, give me the boom. So creators, what do? We'll look up on Google Trends. We'll look up SEO titles. We'll try to optimize the search engine so you find us. And we title things in a certain way. We fight the urge to do that. Right now we're doing that. Gotcha, but we're giving you the real thing anyways. So
I mean,
but people are only doing that because I don't want to say you guys, but the masses are asking for that. So if you go to the doctor,
there was a quick fix though, like obviously, why would you spend more time doing something if you could get there quicker? It's just not the nature of our body. That's not how we work. And like that's something like personally, I feel for those people who are in it and they're on the internet looking for whatever fix. And it's like, you may be told this quick fix here, this quick fix here. It's too good to be true. If that worked, that's what we would be doing. But that did not work for me. I don't think that's what worked for you.
They're Band-Aids, man. And Band-Aids can't heal what building can. And so don't blame the doctors, don't blame the content creators. You're always going to see the pitch for the easy because people are going to always look for it. We can change. That's our mantra right now, is putting bullshit out of business. And it's not competitive to annihilate every other trainer. If we raise the standard, we make the best product we can, we make it for the cheapest, shameless plug-in, lowbackability.com. You can pay what you want. We're going to make a roadmap. It's going to have an app. It's going to be all train yourself. If we could make the best, widely accepted approach, and we make it the cheapest, there's no more gates and gatekeeping and paywalls and secrets, and there's none of that. It's either going to put all of the bad shit out of business, or it's going to force the bad business to become better. And that's the goal, is to just raise the level of ethics, competence, and that comes from demystifying this stuff and just being real. And it's not hate. It's just like, we get too many Zoom calls with members about to kill themselves, or DMs from kids that are genuinely lost, had surgeries, and they're really like at that point. And I just sit and think, well, the only thing that can solve that is truth. Like, put it out. Not to be dogmatic. The truth will set you, but it's like, shit's gotta stop. So this is one exercise to fix your low back. I hope your takeaway is to never give up on your low back. It's a long game. If you have a low back, you gotta train your low back. That's what I got.
What you said squared.
Great.